Welcome home to USA Global TV and Radio, a place where dreams take flight, with authentic storytelling, diverse perspectives and meaningful conversations, where global stories unite and bridges are built beyond all borders. Discover world-class education, entertainment, hope and inspiration. Together, we're building bridges worldwide. Subscribe to our channel, USA Global TV. Download our app, USA Global TV. Be our guest or join our team. Visit usaglobaltv.com. Thanks to our founder and executive producer, Dr. Jacqueline Kerbeck. Music score by Yeffy Tang from Cloud Road Music. Voiceover artist Mike Porter. Creative direction by Paul Garcia. USA Global TV and Radio, your home for global connection. All rights reserved. This video and its contents are the exclusive property of USA Global TV and Radio. Unauthorized use, duplication or redistribution in any form is strictly prohibited.
Hello, everyone. Welcome back to the Compassion Project. My name is Dr. Danielle Lord, and the intent of our show is to recognize, unpack, and call out trauma for what it is. It's all around us, and it's creating a lot of chaos, and it's causing us to not be kind to ourselves and to others. So our goal is to help unpack it, understand it, recognize it, so we can begin to take better care of ourselves and ignite a compassion evolution and take better care of those around us. So very excited to host my guest today, Betty McLean from Aim for Greatness Coaching. Betty is a nurse specializing in nursing burnout. So Betty, welcome to the show.
Thank you so much. I'm excited to be here. I love talking all things trauma and burnout. So as weird as that sounds, but I so agree with the Compassion Project's tenets of like, let's talk about it. Let's bring it out of the open so that we can start to heal it. So thank you for having me.
Absolutely. No, happy to have you. Good to see you again. So I don't like to read scripted bios. I like my guests to kind of unpack their own journey about how they got here. So how did you get here? You're a nurse, still nursing, and diving into this world yourself. So tell us a little bit about your journey, Betty.
Yeah. So I have been an RN, a bachelor prepared nurse since 2004. So 21 years. And most of my nursing career was spent hospital. So acute care, med surge was kind of my specialty where I was for most of my career. A couple of years ago, started having a lot of symptoms and decided to leave bedside nursing. I'm still doing direct patient care, but in home. And so I do that full time. But right during all that transition, I had some very traumatic experiences. And, you know, the funny thing was it all kind of came to a head and I wrapped it up and called it burnout. But as I'm learning more and as I'm diving into the world of coaching and therapy and all things personal development, I'm realizing there were also some elements that we can talk about of moral injury and passion fatigue. And there was just a lot anyway. But I love all things nursing. I love helping nurses recover from burnout and understand their trauma. I'm married. I have 2 dogs and I think at last count, we have 19 chickens. And,
I'm jealous.
we live on 5 acres just outside of Tri-Cities, Washington. And I just feel very blessed. I've got a lot of very supportive family and friends in my life. And I think that's part of the reason that I didn't get as far into burnout as I could have. One of the reasons I was able to catch it quickly was I have a good support network. Came to coaching. Aim for Greatness Coaching is my overall business company name, and started that 2.5-ish years ago. And so I've been coaching nurses. I've been coaching a lot of people, not just nurses experiencing trauma and burnout. But yeah, trying to help people gain some understanding of what they're experiencing. And yeah, that is me in a nutshell. So
I think that the fact that you say you are working with others beyond nursing or outside of the nursing profession speaks volumes to what we're experiencing on a much larger level. But I want to, if we can, Betty, for a moment, I want to take you back to a story that you told me a couple of weeks ago related to your own journey. And I have a reason that I'd like to do that. But would you mind sharing with our audience kind of what brought you to that space where you went through an event and then leading up to that was the kind of that moment where you said, there's something else at play here. Would you mind sharing that story?
Yeah. So I think the story you're referring to of my patient that coded. So I was working acute care, which for non-medicals, it's just people listening. Within the hospital, there's lots of different departments. Medical surgical is where a lot of the surgery patients stay if they have to stay in the hospital overnight. Acute care or medical are where they don't need ICU, but they need inpatient care. So I was working, actually that was med surg. It was before I went to acute care. So I was working on the med surg floor. I had been at work for 2 hours and a patient who was, I thought, very stable. I went to check on them and they had passed. So they were a full code, which means if they stop breathing or their heart stops, we try to resuscitate them. So we did. Push the code button. The team came in. We started chest compressions. We did everything we could not bring this person back. And so we lost that patient. And very standard at my hospital. Now, every hospital is going to do things differently. And I'm hoping that things are going to change. But standard in my hospital, the family was notified, and we kind of got that process going. And the house supervisor, kind of the nurse who was in charge of everything, called everybody who was involved together, who wanted to. It wasn't actually everyone in the code. Most people had gone back to their departments, right? But me and a couple of the other nurses who had helped with the run the code, she called us together and was like, okay, let's debrief, right? So we're standing at the nurse's station. And she's like, I think we did everything we could. He had a lot of comorbidities. Any concerns? And everybody was just kind of like, I mean, yeah. And I was like, I don't know what to tell you. I'm not okay with it, but I don't know what to tell you in this moment, right? And so we all kind of went our own way. And I did not just go my own way, right? I stayed in my head. And I was, over the course of the next couple of weeks, I was constantly replaying. I had seen him at shift change. I had given him some medication. And then I checked on him 2 hours later and he had passed. And I kept replaying. Should I have checked on him sooner? Should I have insisted that he order breakfast? Should I have, all these different things? And I actually at one point told one of the senior nurses, I just can't get over this. I'm not okay. And she said, yeah, that sucks. We all kind of deal with that, but you're going to be okay. There was nothing you could have done. There's nothing you could have done differently. You're going to be okay. So and that was it. She was like, we all go through this. You're going to be fine, And it felt very dismissive. Looking back on it now, for the next year or so, I left that department. I tried a different department. And then I eventually decided, because from there on, I kept questioning myself. And I would have all this anxiety when I thought about going back to work. And I would have all this dread thinking about, I got to go back to work tomorrow. I hope I can. And I felt like I was just slipping. I had been a nurse for like 18 years at that point. But I felt like maybe I'm losing it. Maybe I can't do this anymore. And it didn't occur to me that it was the trauma and the not getting the support that led to that. I just assumed that I was just losing my touch, right? So eventually I found a life coach who was able to kind of help me reframe. Now, she wasn't actually a burnout specialist, but she taught enough self-reflection skills that I was able to do that work. Looking back on it, if I had had a burnout coach, like I would have recovered so much more quickly and so much more thoroughly. But yeah, that was, and that event, now that I think about it, like that led to a lot of situations where I probably, if I hadn't have had that trauma and been dismissed, or if I had have had that trauma and then had the support around it, events that happened later wouldn't have had such a toll on me, right? I would have had the
Yeah.
resiliency to come back from those without them being quite so devastating. So it was kind of the
Yeah.
start of the end.
Yeah, that makes perfect sense. And I thank you for sharing your story. I think that, these are stories that we need to get out there for multiple reasons. But one, because I wanted to talk a little bit about how we bring our situations to life and we allow them to live by replaying them. We give them a voice. And that voice then is something that becomes bigger than us alone. And it requires an event like you going to a burnout coach to kind of break that cognitive dissonance that we have, or allow or to stop that voice or that story from happening and occurring on and on and on, which you just relive it after that, which is just re-inflicting the pain over and over. So did you experience any physical symptoms with that as well?
And this is why I said, like, I think I was lucky, because I know that at the later stages of burnout, I've done quite a bit of research and learning on burnout and the stages of burnout. And I know that as you get further and further into burnout, it becomes not just a mental problem, but it becomes a physical problem. I did not get into the point where some people with burnout end up getting into a point where their body really does start to shut down, and you see a lot of like autoimmune diseases. You see really severe physical. I dealt with a lot of anxiety, and it never really got to the point where I had a lot of trouble sleeping. Except maybe a little bit right before a shift, I would have a hard time like falling asleep, calming my brain. So there was a little bit of sleep disturbance, but that's pretty common in those first couple stages of burnout. I was lucky. I feel like I had the enough social support that I didn't spiral too fast or too hard into the point where not only was I emotionally fatigued, but then I was physically fatigued. So I feel like I kind of lucked out a little. I don't like to say luck because it wasn't luck. It was the support of my family and my friends, right? Who they didn't really even do anything specifically, but I knew they loved me and supported me. And so I felt that support as I tried to decide, do I leave my job? Do I, quit nursing altogether? Do I quit working with patients? Do I, all those decisions that I was trying to change my external world to fix my internal world. Right.
Yeah, that's a great way to say it.
And I had a lot of support as I dealt with that. And a lot of support as I moved, as I found a life coach. I had a lot of support from my family in realizing, like, as I started to realize, like, my brain is not okay. I'm having a lot of thoughts that are not helpful that I need to reprogram. I had a lot of support, especially my husband has been very supportive of, like, all right, I see what you're going through. How do you want me to help? Right. Nothing's gone wrong. I'm here. He didn't really necessarily do anything. He was just there and supportive. And so I guess I'm kind of lucky with that. I know a lot of people don't have that, and that makes recovery that much harder.
Oh, absolutely. Absolutely. But I think what you said is so fascinating about that whole mind, body, spirit, mental, emotional, physical connection, however you want to frame it, right? It's so powerful that this trauma, burnout, compassion, fatigue, oh gosh, the name just went right out. Moral injury.
Moral injury.
How devastating it can be for us. So so I have spent most of my 32-year career has been in healthcare of some degree. Now, I have not been at bedside in a clinical role per se. And my dissertation was actually on nursing dissatisfaction. So I certainly have a lot of love for nurses as well.
Yeah.
But you know, nurses, I think, are in this odd space, right? We've got two circles of different varying types of clinicians, if you will. So we've got the physicians who kind of have some form of capacity, whether it's innate or learned, to really compartmentalize things.
Yeah.
Right? And I've talked to other trauma surgeons about this, and it's that classic listy brief, right? Without any sense of, wow, people might be actually hurting, right? Yeah. And then there's the other clinicians, like the therapists, the physical therapists, the respiratory therapists, who kind of see things or the patients kind of after the fact, if you will, right? They might see the healing when they get more involved. But nurses kind of sit in this odd space in the center where they kind of see it from the beginning to the end. And in addition to that, nurses have this really toxic culture of just get over it. You mentioned in another conversation, just drink wine until you fall asleep. Yep. Okay, super unhealthy. Or nurses eat their young, right? And so I think nurses in general kind of having that trauma coming at them from multiple different angles, which I think makes this such an even bigger topic for nursing and healthcare in general.
Yeah.
So that was kind of a long-winded way of getting to my next two questions. Are we seeing any change, real change in healthcare, do you think? One. And two is, now am I going to remember what these questions are? How does this more broadly impact everyone? Because I think a lot of times we hear people say, well, this is a nursing problem or this is a healthcare problem, but it isn't. It's actually much bigger than that. So I'll let you tackle those two questions in a way that resonates best with you.
So, yeah, these are great questions. To your first question, no, I don't think we're seeing change yet. I think we're seeing a lot of awareness that, and a lot of acknowledgement that the system is broken and we cannot continue this way. And we see a lot of people saying we need change. Everything's broken. We can't continue this way. But I don't think anyone's doing anything truly transformative yet. And the way I think we transform is we give nurses the power to heal themselves. So what I mean with that is, you mentioned nurses eat their young, right? There's this phrase that if you're not a nurse, it probably sounds terrible, but we've all experienced it, where a nurse, whether or not they're new or old, seasoned or a novice, they're having a rough day and somebody comes to them and says, hey, can you help me turn bed 3, right? And they're like, just figure it out on your own. I can't believe you're asking help with that, right? And they give this attitude, or they roll their eyes and they're like, no, right? Or whatever kind of not helpful response, you get. It's not the compassionate, loving, like, oh, I'm so sorry, I can't help you with that right now. I'm busy, but you know what? In 5 minutes, I've got you, right? It's not that. And we're seeing this more and more. And we're really quick. A lot of nurses are really quick to label it toxic culture, or nurses eating their young, or whatever. I actually have I did a whole 2 episodes of my podcast about what to do if you have a toxic coworker and what if you are the toxic coworker.
That's always a good question.
Because here's what we mean when we say nurses eat their young, or we have a toxic coworker. Someone is not dealing with their trauma appropriately.
Agreed.
When I'm short with you and I won't help you and I'm wrapped up in my own negativity, it's because I'm not dealing with my trauma appropriately. I mean, really, very few.
That's a hurt person.
Few people in the world are evil.
Right.
Very few. Most people come across as really negative and toxic because they are damaged and don't know how to heal.
Exactly. Yeah.
If we can start getting nurses calm, get them the skills they need to calm and regulate their nervous system, give it around moment to moment. If we can get nurses to the point where they acknowledge their trauma and they get help healing it, the patient interactions are going to be better.
Yeah.
The doctors are going to be more supported. The therapists are going to be better supported. The hospital administration are going to be happier because the patient satisfaction scores are magically going to go up.
Yes.
But
Yeah.
it's
Yeah.
because the nurse's internal world is safe and secure. When you aren't safe and secure in yourself, there's no way to offer safety and security to someone else. So how and that if you think about a healthy, secure, safe nurse, yes, the hospital is going to be better too. Everything's going to be better. But also
Patient as well.
their home life is going to be better. Their
Yes.
family is
Yeah.
going to be better cared for. They're going to take better care of themselves on their day off. They're not going to have to go home and literally drink a bottle of wine, right? And have alcohol problems, right?
Yeah.
Which is
Yeah.
so ubiquitous. Like it's so normalized for nurses to just numb out their pain. But if they don't need that because they are healed and they know how to reach out for help when they need it, they know how to get support, they know how to offer support, they know how to be emotionally mature, like they won't need numbing activities, right? They won't need alcohol, they won't need to like doom scroll on Instagram for 8 hours a day, right? Like when you have healed people, their communities are better off and they
100%.
can support people better. So I think in my brain, fixing the healthcare system starts with healing nurses and giving them the support they need.
I love that. That's awesome. But yeah, I think that's so true. And that's a huge part of the conversation that we have on this show is that, hurt people, right?
Yeah.
So we see so much of this pain and frustration all around us. And it's because we're all hurting to some degree. We just don't know it or we don't understand why. So yeah.
And then the flip side of that is hurt people, but healed people can heal people.
Yeah, absolutely.
Right?
Absolutely.
Right?
Yeah.
So we need more people doing the healing work. First for themselves, definitely do. And then for others.
Yeah, for certain. And you brought up patience too. And I know there've been a lot of psychological studies that have said, we are very intuitive beings and we know when something is not right. And so even when we're in an isolated bed in a hospital room, we can pick up on that tension. We might not be able to identify that that's what it is, but we're picking up on that tension through frequency of some degree, and we are not healing as a result or not healing as fast. So, yeah.
Oh yeah. So I've had patients. I remember patients telling me, "Oh, you guys don't like each other very much, huh?" Or, "Oh, that nurse must be having a bad day." They know. They're even if you try to act professionally in the room, they know when there's tension or when a nurse isn't well. They know.
Yeah, for certain. So what about going a little bit more broader now from this idea of the patients picking up on it and it limiting patient healing, right? We talk about this again. Well, it's a nursing problem. So, and I heard this all the time when I was doing federal work around the nursing shortage. Well, you're not a nurse, so you can't fix it. Oh, well, okay. But what about, as it relates to burnout, compassion fatigue, for all of us who at some point might be in a bed, what does that mean to us? Not necessarily just that we're picking up on the tension, but staffing shortages and how we're treated through a lack of compassion. Do you have any thoughts around that?
Yeah, that's so interesting when I hear nursing shortage. I actually think I've heard, and I don't know, I've not done the research, so don't quote me. But if every nurse who carries a license would be willing to work full time, we would not have a shortage. There are licensed nurses available. The trick is they're not willing to work. Either they can't because emotionally, physically, mentally, spiritually, they are broken, or they're not willing to be in a situation where their administration doesn't appreciate them. Their coworkers are all struggling and toxic, and they're just not willing to work it. I worked with so many excellent nurses who would only work per diem. They would not take a full-time position because they wanted to be able to say, nope, I'm not coming to work for the next 3 weeks.
Want to have more
You know,
control over that.
I will only work on my terms. So when we think about the system and because there is a shortage, like there aren't enough nurses that are willing to work. So it's kind of scary to think about, I have older parents. My health, thankfully, is fine right now. But I have older parents and family members who have problems. And if they need to be hospitalized or even go in and see a specialist, it's three months to see a specialist, right? But I think it's one of those things where, as the person who might need the health care, I don't think there's a whole lot we can do other than make sure that we're emotionally not that we're emotionally resilient. Because if you are, again, for me, it comes back to, are you taking care of yourself emotionally and spiritually and physically as best as possible? Then when you go into that situation where you do need care, if that nurse is not okay, you can kind of give them a little bit of grace and be like, obviously you have not healed from your trauma. I'm not going to rely on you for my emotional care. Because right now there are so many hurting people who are hoping, this is what I'm seeing anyway. There's a lot of just trauma that is not being resolved. And a lot of times people end up going to a healthcare facility, their doctor, an ER, because they have emotional trauma and they don't know where to go, or they don't have resources. We don't have enough resources, right? And so they're hoping that the nurse can care for their body, their spirit, be everything to them. And that's just not what nurses do.
Right.
Nurses have that ability. We're not trained to care for people. Well, classically trained nursing schools do not train us to guide people spiritually or heal people from trauma, right?
That's very true. Yeah.
Guiding people spiritually is a priest or a pastor or a spiritual person's role in the community. Helping people heal from trauma is a therapist or a trauma-informed coach's role, right? But right now in our society, in the American society, we're expecting doctors and nurses to fix every part of our being. And it's really not the doctor's role or the nurse's role. And so it's getting very, very difficult. We kind of need a little bit of a shift, is what I'm seeing.
That's very interesting.
That's a very long-winded.
Yeah, no,
Sorry.
It was a really great explanation. And I think you're spot on with where we're going to the allopathic healthcare system for everything, rather than trying to take a long, hard look in the mirror and ask the question, what really is going on and what do I really need, rather than just a pill in a bottle, perhaps. So I think that's really spot on. So many questions. Yeah. So with that, how can folks find you, Betty? What's the best way for them to reach out to you if they're saying, oh, I need Betty in my life, I've got to overcome this pain?
Yeah. The easiest way is just to email me, Betty at aimforgreatnesscoaching.com. But I post regularly on social media. So I think, Facebook, Aim for Greatness Coaching, Instagram, Aim for Greatness Coaching. I also have a podcast. Nurse Burnout Solutions on Apple Podcasts and Podbean and Spotify. So, and I'm on YouTube, Nurse Burnout Solutions on YouTube. So, emailing me or just reaching out via any of those channels is the easiest way to just get a hold of me and say, hey, this is what I got going on. I love to do, so I have one-on-one coaching available, and I love to do a free consultation first, so that I get to like have a chat with you and see if a life coach is who you need to talk to, or maybe you need to see a therapist. Maybe you've got some undiagnosed PTSD or some clinical depression going on, and you need to see somebody who can diagnose you first, right? So I like to have that that free consultation call first, to make sure that my style of coaching is appropriate for people. And so but I'm available on all of those channels, or just emailing me at betty@aimforgreatnesscoaching.com. So
nice. And I think it's fantastic that because you do have that background in nursing,
yeah.
you are able to make a call to say, I don't know that I'm the right person for you. So I love that about your approach, Betty, is that you're not going to take everyone into your coaching circle just because they present to you. So that's fantastic. And you also do some group coaching as well, right?
I do. Yeah. So about once a year, I'll do a group coaching program. So I currently am open for a 10-week nurses burnout program that'll start January 10th. So if there are some nurses in the audience who want more of a group coaching experience, that would be perfect. It's going to be just 10 weeks, and we do an hour-long call where we do all the coaching, all the things, and then they also get some pre-recorded lessons about things like boundaries and perfectionism, which is can be a struggle for nurses, and all of those things that you need to create that safety and that emotional resiliency, right? So that you can be a more effective human. So
nice.
and if that's something that someone who's listening is interested in, just emailing me or going to any of my websites is perfect.
Fabulous. Thank you. And I would add too that Betty is part of Compass, which is a support. I don't want to call it a support. It's a resource group that I have co-founded with Michelle Garamani, who is a trauma coach as well. So Compass is coaching or mentoring for providers affected by stress and strain. And so you can find that through my own website, and Betty is a part of that as well. So we do a lot of work, again, helping any clinicians heal from some of the trauma, compassion fatigue things that they're experiencing. So, wow. Well, there is still so much to unpack here, Betty. I hope you'll come back and continue this conversation. But I love your message about, we have to take control of the situation ourselves and not rely on others to do it for us. And we can do that through really healing ourselves. And that, I believe, truly that's where it begins. And we share that same thought. So last question I always like to ask my guests: how do you propose we provide self-compassion for ourselves, or what would you offer for a self-compassion mechanism beyond self-care?
Right. Yeah. Yeah, self-care, we throw it around so much, right? But really providing yourself, because I like to say self-care is just self-kindness, right? And that kind of leads to that self-compassion. I think it starts with, I like to gain a little bit of distance, especially when I'm kind of being short with myself, or not following through on things, and I'm getting kind of with myself. I like to give myself that little bit of distance and think about how I would talk to myself if I were my best friend, or if I were I don't have children, but if I were my little 9-year-old niece, would I be talking to her this way? Probably not. I would give her a little bit of compassion, and maybe I would give her a little bit of love, a little bit of tough love, but I would do it in a compassionate way. So I like that technique of like thinking of myself as my best friend or my little niece, as a way to kind of get a little bit of distance from my kind of nitpicky self. That's one of my first go-to techniques when I need to offer myself that compassion and that kindness.
Nice. So step away, step back a little bit and assess and give yourself a little bit of love. I love that. Thank you. Well, thank you for being part of the conversation, and together with anyone else who is interested in bringing this type of awareness into the conversation so that we can all begin to heal and take control of that healing rather than relying on somebody else outside or in that external system to do that. So thanks again for being part of the conversation. And absolutely. I would just invite again, so Betty McLean, Aim for Greatness Coaching. And thanks again for being part of it today. And I know we'll have lots more to talk about. You're very welcome. Yeah. So like to thank the show, USA Global TV and Radio. Thank you so much for hosting us, and producer Jacqueline and our sponsors. Please do like, subscribe, and share, and bring some comments in, and let's continue the conversation after the show is over through your comments. I will certainly answer those comments and questions if you have them. Again, this is, I'm Danielle, Dr. Danielle Lord, hostess of the Compassion Project, where we are aiming to unpack, identify, and bring to light the trauma that's all around us so that we can together heal and ignite a compassion evolution. Thanks for being part of the conversation today. Thanks again to the show and the producers and our sponsors. And I will say that coming up, I've got some exciting guests coming up later in January is Alicia Alexander talking about the power of forgiveness. And then at the end or beginning of February, we're having Dr. Amber on talking about toxic feminism. So a couple great shows to look forward to. Hope to see you then. And thanks very much.
Have you ever felt unheard? Like your words float into a void, leaving you invisible and disconnected? How about feeling judged, when assumptions overshadow your truth, leaving you misunderstood and defensive? And then there's that moment when someone offers solutions you never asked for, dismissing your feelings and leaving you more frustrated than before. It doesn't have to be this way. Dr. Jacqueline Kerbeck, the listening mentor, understands. She's here to help you reclaim your voice, build stronger connections, and create meaningful conversations that inspire understanding and mutual respect. Through her groundbreaking books, online and in-person courses, and interactive workshops, you'll learn how to navigate life's most challenging interactions. Discover the power of elevated listening and transform how you communicate. Master setting boundaries and asking permission to protect your peace. Learn to recognize and release judgment, fostering empathy and true connection. Dr. Kerbeck also offers personalized coaching, one-on-one or group sessions designed to fit your unique needs. Whether in person or virtually on StreamYard, her guidance will empower you to thrive. You don't have to struggle alone. The path to deeper connections and better relationships start here. Visit drjacqueline.com or usaglobaltv.com. Join a global community of empowered listeners and transform your life, one meaningful conversation at a time. Dr. Jacqueline Kerbeck is the listening mentor. Start your journey today. In a world full of noise, misunderstandings, and interruptions, master the art of listening with Dr. Jacqueline Kerbeck. Dr. Jacqueline Kerbeck is the listening mentor of USA Global TV and Radio and the Amazon #1 best-selling author of Mastering the Power of Elevated Listening. Elevate your listening. Elevate your life. Join a global learning experience in person or via Zoom. Reserve your spot today. usaglobaltv.com/book-your-session or drjacqueline.thinkific.com. Join Dr. Kerbeck's listening courses or hire her to unlock deeper connections and authentic conversations.